The most important role a hygienist plays is educating the patient on their home care and meeting them where they are. My patient here, Anna, she has type 2 diabetes, rheumatoid arthritis, xerostomia, and areas of recession seen in the mandibular molars. So the xerostomia is related to medications, and the recession is due to scrub brushing. She also does have plaque buildup around crowns. The methods of toothbrushing I would prescribe to this patient would be the standard occlusal method. We all use that for our pits and fissures, and we use it along with the Bass, Stillman's, or Charter methods. The Bass method, which is site-specific, and it's for succular cleaning, periodontal health, and disease and maintenance. We use that with modified Bass, which uses a sweeping away from the gingiva, used in conjunction with the Stillman's method for areas of recession. The patient should use a tongue cleaning device because it will reduce the number of bacterial organisms, control malodor, it improves your taste perception, and your overall cleanliness. This can be achieved with a manual toothbrush, tongue scraper, or power toothbrush with a special attachment. We need to be careful when scrubbing or scraping because it can cause trauma. The dentifrice I would recommend for my patient would be Colgate Tartar Control or an Aquafresh Tartar Control. For the interproximal care, which my patient does have type 1 or type 2, so I would use interdental and interproximal brushes, a rubber tip stimulator, or a floss holder, so to help with dexterity issues due to rheumatoid arthritis. The rinses I would recommend would be any oral rinse with no alcohol and fluoride. Patients have had a lot of success with TheraBreath dry mouth rinse, and it is safe for diabetics. We always recommend soft bristle brushes and to apply gentle force. The patient should brush 2 times daily and for 2 minutes. Toothbrushes are replaced every 3 months. The patient should use C-shaped flossing with the use of interdental brushes and tips like this, or to use thicker floss. Okay, so when we're using the Bass method, we want to make sure that our toothbrush is angled 45 degrees to the long axis of the tooth. We want to make sure that we're going to do circulatory, vibratory motions, and we want to make sure that we're using light pressure. In areas of recession in the back of her mouth, we were going to rise up on the gingiva, the soft tissue, and on the enamel, and we're going to be using controlled brushing forces. We want to make sure that we're using short and back and forth vibratory strokes, and this is for, okay, so now you're going to show me. Very good. Okay, so that is excellent, but I would just have you go just a little bit slower with gentle, perfect. Good job. And just don't forget to sweep down from the gun line when you're on the top, and then when you're on the bottom, you're just going to sweep up. Very good. And for the flossing, we want to make sure that you're going to hug the side of the tooth, really getting into those interproximal areas. Very good. And you're going to come out very gentle so we don't hurt any of your tissue. And we would like to try to do this every other day to start. We're going to work with what you